Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hello, Dr. Darrow.
Hello, Nita Valens. How you doing today?
Doing great. How about you?
I'm living it up. Can't you tell?
I can. I mean, we're in our, 12th year together, and you stay pretty resilient, I'll say. And you stay very happy, and you stay very contented, and I think it's because you love this work. Speaking of this work, I want to let the listener know that if you're suffering any kind of chronic musculoskeletal pain, that's basically orthopedic pain, then this is the show for you. And you want to give us a call all hour long. We'll take your calls, and you can speak directly with Dr. Darrow at 866-870-5752 right here in the studio. And if you're wondering what orthopedics really basically refers to, that's muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, knee, hip, arthritis pain, perhaps carpal tunnel syndrome is bothering you, tendonitis, stiff joints, dull aches that maybe you don't even know what they are. Give us a call, and Dr. Darrow will try and help you figure it out. That number again is 866-870-5752, and when you phone the program today, you get Dr. Darrow's latest book for free. Stem Cell and Platelet Therapy is the title. The subtitle is Regenerate, Don't Operate. It has over 264 scientific studies, and the foreword is written by the actor Suzanne Summers, who also wrote a book recently and put you in it. And reminding you that we are here Saturdays at 10 and again at 1 p.m. And also you can go to Dr. Darrow's website and find a wealth of information at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch Dr. Darrow performing the treatments on video. Would you like to go to Danette?
Why not? Let's get rocking and rolling right away. So this Dr. Marc Darrow, Danette, and I understand your hips bother you. Can you tell me how long that has been going on for?
About 5 years now. It's more in my sacrum area.
Okay. And what did the doctor tell you is going on?
Well, they want to just call it arthritis, but I think it's more than that. I do go to chiropractic care, which relieves some of, and I've had about 4 cortisone shots over time. Last year it completely locked up me, and my right leg still feels some numbness from it after my shot. So I just
did the shot cause the numbness?
No.
Did the
relieve the pain? I was in excruciating pain for about a month. I couldn't.
Did the cortisone shots? Did the cortisone shots cause the numbness, or is the numbness there first?
I think it was just the pinched nerve that the numbness is now just a leftover from the effect that I had.
I gotcha. Good. Okay.
Yeah.
Anything else? Did you get an MRI of your low back?
They did. They did an MRI. They said that there's nothing that they can see. There is some, pinching in the area, but they didn't really have a fix for it. And,
okay. Well, you just told me the best news anybody could tell me, because if your MRI is negative, if the MRI is negative, that's a great thing, and that doesn't mean that because the MRI is negative, you don't have misery, and you don't have numbness, and you don't have pain in your low back. So the first law of this type of medicine is don't believe your MRI or X-ray or CT scans, okay? Because we know you have a problem, and the MRI didn't show it. But the reverse happens all the time too, where people see an MRI or an X-ray, and the doctor says you need to get surgery when they never needed surgery. In your case, it's the reverse, which I love. They said you don't need anything. They don't know what to do. That means that it's probably something I could help you with using stem cells or platelets from your own blood. It's called PRP, platelet-rich plasma, or we can take your own bone marrow and get the stem cells from it. It's a very simple procedure. The way I do it, after I numb up the area, it's right above the it's at the PSIS, if you want to look that up. It's the posterior superior iliac spine. And if you go to my website, you can actually watch videos on this procedure. It's www.lastemcells.com.
Yeah, I mean, I've been listening to your program for a couple of years now, and
oh, great. Okay.
And
so you're the kind of patient that I can probably help very easily.
Yeah, I mean, I'm athletic. I don't do anything, extreme, but I just feel like there's got to be some better way. I'm 55 years old, and I feel like if I'm in this much pain every day, even though I stretch and exercise, I just feel like I'm worried about what it's going to be like another 10 years down the road.
Sure. So I have a question for you, and this is not pointing any fingers anywhere or accusations. It's just curiosity, and it'll help other people understand what my work is all about and understand your condition. So you've listened to me on the radio for 2 years, but I've never met you, right?
Correct.
Okay. So if you've listened to me, you've heard me say over and over that there usually is no need for surgery in these type of cases, and that I can usually help you. But I've never met you. Why is that? Why have you not come in? And it's not pointing a finger at you. It's just a curiosity, because a lot of people are the same way.
Laziness?
I have people that a laziness. Okay. So to me, that's a good thing. You know why?
Why?
See, I can find the goodness in everything. The reason is because it means you're not that bad. It's a nuisance, but it's not bad enough to fix it.
Yeah, last it was I went and I had a Thai massage, and she did something that irritated they thought it might have been that she caused bursitis in that hip, and that was what led me down that spiral of excruciating pain every day for 2 weeks.
Okay.
And then I couldn't walk, but it was all related to the same area.
Right. Well, Danette, there is a confusion in my mind about where this problem is, and the fact that someone said it was a bursitis on a deep massage means that the area may not even be in your back or your hip. It may be where the muscles attached to the greater trochanter. Write that down and look it up, and then hit images on Google, and it'll show you different parts of the body. And then what you can do is you can just email me through my website. There's a spot on my website on every page to email me, and that's www.lastemcells.com. And after you look on Google, you'll have more of an idea of where your pain is really being generated from. Pain is not generated from MRIs. It's not generated from X-rays. So I like to see them, make sure there's no cancer or something weird going on. But they don't tell me how to treat. And unfortunately, surgeons go by their MRIs, and a lot of times they never touch the patient. I have so many patients who've had failed surgeries, meaning they went in for a surgery they never needed, and they never got better or they got worse because the surgeon operated on the wrong area, but he did it based on an MRI. And the patients, I say to the patient, did the doctor ever touch you? No? Well, how does he know what's going on? I don't know. He said, he looked at the MRI and he showed it to me, showed me the spot. And it was never the spot to begin with. So be very careful. You've got to do your due diligence. It's your body. You own it. The doctors don't own it. I don't own it. I own my body. And, a story years and years and years ago, before I knew about this kind of medicine, is when I was a fourth-year resident at UCLA. And I injured my wrist in a golfing injury. I hit the ground real hard, about 100 miles an hour, and hyperextended my wrist backwards. And, it looked bad. I couldn't pick up a pencil. It was excruciating. And my surgeon buddy said, well, let's just go in arthroscopically and take a look. And I didn't want to do that for fear of a bad outcome. And then I injected myself with regenerative medicine. This is a long time ago. We're talking 22, 23 years ago. And it healed up. And that woke me up. Then I did my shoulder, and that healed overnight. And I've been in self-injecting myself ever since. I've done both my knees, both my shoulders, both my elbows, my right wrist, and I can't do my neck or back, but I've injured those also, and I've had other friends do that for me. So I think from what you're telling me, there's really, really good hope that regenerative medicine using platelets or stem cells or both can heal you up. But you got to come into the office. I mean, if you've been listening for 2 years, I don't expect to see you.
I'm going to tell you something that you probably don't want to hear, but I have been listening to you for a long time, and my husband was told he needed a knee replacement, and so I suggested you to him. Yeah. He looked in, and he went and he had a stem cell injection in his knee, and I guess I just assumed he went to you, and it was a couple of years later I said, well, you did go to Dr. Darrow for that, right? And he said, no. I go, oh, who did you go to then? It was one of those moments. But anyway, the thing was it did help him immensely. And,
oh, good.
In our 50s, we just don't want to have to do knee replacement surgery. And so that, has been working very well for him. He's very active. He's
wonderful.
He rides bikes.
See, you're not hurting my feelings, Danette. I'm glad that he's better, and I don't care how he did it. If he went to a Ouija board and got better, I'm happy for that. Do you know what I mean? So I don't care who did the work. I'm just happy. My joy in life is seeing people happy, and all my patients will tell you that. I am, I'm like a joy coach. I like to be happy, and when I walk in the office, I put on my Superman suit, and I don't care how I feel. I'm going to be happy. And I just meditated. I just finished meditating for an hour, and in that meditation, I go to pure bliss, and that's the place I work at taking with me all day long and all night long. So that's my goal in life, is to find the bliss, to be able to work in healing and see my patients happy, and anywhere they can get happiness, grab it, because there's not all that much happiness on this planet. You got to go find it.
Make our own.
And you got to look around and find it. And healing is, for me, the greatest happiness I found. That's just my niche, and I've been very lucky to have been put in this spot, to have had my own injuries that were healed with regenerative medicine instead of surgery. And if you've listened to me, you've heard my story. I had a shoulder surgery when I was a dummy back in medical school. Yeah, I was a dummy because I wanted to be an orthopedic surgeon because that was cool. And I loved going into the surgeries. Boy, did I love that. That's a real, it's like playing football or something. We have the rock music blasting. It's all guys in there. You rarely see a female orthopedic surgeon. There are a few. But it's a guy thing, And most of us were very good athletes that were in orthopedics. So it was just a real guy club, and I loved it. And then I had my boss operate on my right shoulder, and I'm not saying he did anything wrong, but it came out awful. My arm was as big as a balloon full of fluid, and I couldn't use that arm for a couple of years. And then I found out about regenerative medicine. I injected myself, and this is a great story. I came home with my syringes, and my wife was lying in bed watching TV, and I jumped in next to her, and we're watching TV, and I pulled out my syringe, and I started to inject my shoulder, and she started swearing at me. What the expletive are you doing? And I said, well, I did it on my wrist, and it worked, and I want to try it on my shoulder. And I woke up the next morning, and my shoulder, after a failed surgery, was completely 100% pain-free with full range of motion. And that was it.
Wow.
I knew at that point that I was going to be a regenerative medicine doc. And that was like 22, 23 years ago. And since then, I have on average maybe 80 new patients a month. Times that times 22 years. And I have helped a lot of people. If I never do another one, I have felt I've done a great life. I've sacrificed a lot to be part of this type of medicine. It's frowned on by the medical community because our culture is surgery. No way to get around that. That's our culture right now. But it's shifting. I've been teaching this at UCLA to the residents there for 20 years or so, and I've helped produce a lot of people that are becoming healers, that are out there to help people without surgery. And I feel good about that as my life work. So I'd be happy to see you.
And I appreciate you. I appreciate your information and your knowledge, and definitely I will be getting in contact with you. I'm ready.
Let me give out my office number to folks that don't have it. You probably do. It's 800-300-9300. That's 800-300-9300. And I would love to see everybody. And we give away a free book when you come into the office. You're also getting a free book for calling in. And you can take more than one book. You can give one to your doctor. I don't care. Let them see the research. This book has, Nita, how many studies in it on this stuff?
264 scientific studies, actually.
Yeah, these are studies in journals. They've been peer reviewed. I'm looking at them right now, and in my book, for those of you watching the video, you can see it. So I'm very enthused. I hope I can do this till the day I leave the planet. I have zero desire to retire. Zero. I'm 72 years old, and I work a full 7 days. I get out a little bit in the afternoons on the weekends to play golf, so I'm happy with that. I get to work out, and I've got a great wife and a great family. I've got everything I've ever desired in my life, and a line of, I'll use the word work, but it certainly is not work. It is a joy to see my patients. And I feel like I am the most fortunate person who has ever lived on this planet because of the work that I do.
That's quite a testimonial.
Well, thank you very much.
God bless you, Danette.
For sure.
Yeah.
Thank you, Danette. Appreciate your call.
Take care.
Our number is 866-870-5752. Right here in the studio. Give us a call. And the time flies by, and I have lines open for you right now. And let's go to Dan in Redlands.
Hey, Dan, Dr. Marc Darrow, how are you today?
I'm doing excellent. How about you, Doctor?
I'm living it up. So your knee
right.
has bothered you for how long?
I actually got a stem cell injection from you about 10 days ago in my knee.
Oh, okay. Well, I hope you have good news for us.
Well, what I did is I tried to pay attention to what you told me. I got some crutches, so I've been totally staying off of it other than a little bit of walking. And my question to you is, when I come in and see you here for my follow-up, how do you measure the progress and know, when you're healed?
That's a great question. It's one that everybody asks. And unfortunately, most people think that they'll get another MRI and see tissue growth. And that's something that I do get to see, but you don't get to see it for about a year after treatments are done. It takes a while for tissue to grow. But most important is not what we see. Like I said, I don't trust MRIs or X-rays. What's most important, Dan, is how you feel. And if you come in better than you were before you met me, we've got a home run.
Well, it felt better just when I left. So,
okay.
And like I say, I've been staying off of it, and I'm just sure, and we'll talk about this more when I come in next week, is, whether I should challenge it or not, or, or whether I need another injection.
I wouldn't challenge it yet.
Here's
what we do. You come in the office, and if you're 100% better, then we'll challenge it right at the office. We have stairs there. We have running paths around the office. There's all kinds of things people can do right in the office or outside of the office to test the area to see how they're doing. But it's best if you at least wait a few more days. You're coming in probably this week, is that correct?
Yeah, probably towards the end of the week.
Okay. Do you have an appointment?
No, but I'll make one.
Okay. I would suggest you do that because we're getting jammed up. Now that COVID is on the way out, all the people that were hiding in their houses are coming forth, and we're getting slammed again. So I would call right now. There's people by the phones. You can just call the office at 800-300-9300, and I would reserve a spot. If you can't make it, you can always call us beforehand, but I would get a spot set up because I'm working late these days trying to see everybody. So I'd hate for you to miss that 2-week window to come in.
I'll call in as soon as we're done.
Wonderful, Dan. And congratulations. It sounds like you're doing great and taking good care of yourself. And it sounds like the stem cells are working for you. So congratulations.
Yeah, the only thing I've experienced is maybe a little bit of stiffness, and I think that should be.
That's right, because one of the processes in regenerative medicine that helps healing is inflammation. And I wrote a whole book about it called Prolotherapy Living Pain-Free, which I have right in front of me right here, right now, which is the old-style regenerative medicine. And it's got photographs under the microscope and the science and the graphs of how we heal. And one of the ways we heal, I'm showing the picture to the camera, is through inflammation. So let's say you sprain an ankle and it swells up, okay? And people go, they use expletives. They don't like that. But that's nature's way of healing. It brings fibroblasts to the area, which are cells that grow back the collagen and the cartilage. So the stiffness is fine. Not everybody gets stiff. Most of the time when I inject myself, I get stiff for a day and a half or so, or sometimes longer. When I did my left elbow, from weightlifting and playing tennis and whatever it was at the time, this is, almost 20 years ago probably, it stiffened up for 2 weeks. I could not bend my elbow. And it was back in the days when I was still experimenting with this. There were no classes on it or anything, and there was nowhere for me to go, and I was worried. And then I woke up 2 weeks later in the morning, and my arm was completely healed. But it was 2 weeks of very severe stiffness, but I had used sodium moruate on it, which is a very, very strong proliferant, and it irritated the skin and the tendon as soon as I put the needle on it. So you're doing perfect. What you're talking about is what we all look for. And I'm looking forward to seeing you this week. So God bless you, Dan.
Thank you for your call, Dan.
Thank you, Doctor. I'll see you. Okay.
Okay.
And our number right here in the studio is 866-870-5752. That's 866-870-5752. I have lines open for you right now. And we have Helen in Los Angeles.
Helen, Dr. Marc Darrow, how are you today?
Hi, Doctor. I'm 85 years old, and I've been in pain for over about 32 years.
Okay.
I have trigger points with a secondary fibromyalgia in my upper back at the neck area and the cervical spine. Yeah.
Okay.
And then also through the years I've been to so many doctors.
Yeah,
I
sure.
have osteoarthrosis of the cervical spine.
Okay.
And one in UCLA said that I have degenerative
disc disease
at L4.5 with mild foraminal stenosis, and there is left-sided facet arthritis at L5, S1, and scoliosis.
Okay.
Yeah,
do you have any pain? Hang on. Do you have any pain? Do you have any pain down your leg?
Huh?
Do you have pain down your leg?
It's all over now today. Especially.
No. Do you have pain down your leg from your back?
Yes, and I have also neuropathy.
Okay, Helen, stay with us. Stay right there because we have to take a quick little break here on Living Pain Free with Dr. Marc Darrow, but we're going to be right back with you, so give us a couple seconds, okay? And you grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, Call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.